Thank you for having me. I thought my best value today would be to provide a little bit of the history of the Mental Health Services Act and how it relates to today's proposal as amended, which, by the way, I wholeheartedly support. And I commend you, I commend the Governor, Secretary Galley, Director Boss, everyone who has worked very hard to bring this forward. This proposal was great prior to the amendments. It's even better now. The history is important. How did this all get started? When I was a young assembly member, elected in 1998, I was given some sage advice. Work on something in your 6 years, because it was just going to be 6, that is really important to the state that no one else is working on. You'll be able to have your own North Star, and you'll be able to make a contribution. And I met a gentleman by the name of Rusty Seelix, the late, great Rusty Seelix, who was the head of the Community Council Mental Health Agencies, and together in 1998 we wrote AB 34. And AB 34, which became AB 2034 over the course of 2 years, we were able, even in tough economic times, to convince the Governor Davis and the legislature to put $55 million into what we called integrated services for the homeless, mentally ill, whatever it takes. Assertive outreach, case management, wraparound services, shelter, and housing for people. And over the course of those first years, we showed dramatic improvements in and reductions in rates of hospitalization, rates of days of homelessness, the number of arrests, increased housing placements, and even the beginning of increased employment. In about 2003, we looked at each other and said, are we satisfied with $55 million a year? Because the original premise was to try to get the state to uphold the promise made by Governor Reagan and the legislature back in the 1960s when they shut the state hospitals to fund a decent system of community mental health care. And we thought, maybe audaciously, that if we went to the ballot, that we could uphold that promise. And so we did, and we put together Proposition 63, and we're the first to choose the millionaire's tax. And under the radar campaign, many other things going on, we passed it with 53% of the vote. And over 20 years, the act is, I think, maybe a little bit of author's bias here, has been a great success. I don't think the counties have misspent the money, just the opposite. I think they've done a good job with the money. But if we're honest about it, the world has changed over 20 years. No one was working on mental health then. Now, mental health is the issue of our time. If we're honest about it, up until Governor Newsom took office and appointed Secretary Galley and made these issues a signature priority, the flaw in the Mental Health Services Act has not been the county's fault. It's been that the state of California has never set statewide priorities, and what they want is massive amount of money, because there's now $4 billion plus to go towards. And so over 20 years, the counties have done a good job with the money, but if we're also honest, we will say that the full-service partnerships, which are the wraparound services, the coin of the realm, the AB 34 model, have not been focused on the chronically homeless. They just have not. And for many reasons. One, it's a really hard problem and hard population. And maybe it's a little bit more expensive. And I don't say the counties have creamed or the program providers have creamed. They're helping people with serious illnesses, but they are not focused on the people living in the tent encampments. And so Governor Newsom comes along in his administration, and Senator Eggman, with you're now the legislature's leader on these sets of issues, thank you, are saying, how do we fulfill that promise from now, 60 years ago? 50, 60 years ago? Well, it's not just MHSA, because frankly, one of the burdens of MHSA is it's had to bear all of the public mental health responsibilities, because there hasn't been much else. But now you have CalAIM, now you have the Youth Initiative, now you have a real commitment. And so there's an opportunity now to actually build the system. And to go back to the MHSA's original intent, which was not to focus exclusively on chronic homelessness, and that's not the way we wrote it. Rusty and I said 20% for prevention, early intervention, 5% for innovation. But to focus it primarily, at least the service pot, on the people who are the sickest of the sick. And that's what this modernization proposal would do. It is consistent with the original intent, and as amended now, it gives the counties proper flexibility. Secretary Galley is right. The adding the 51% for youth was a very good move. There's actually more money for early intervention than there was in the original act, and the state is simply saying, we want you counties to focus on the strategies of your choice, but they need to be evidence-based. And I'm so glad, Senator Eggman, that you raised the early psychosis identification intervention strategy, because the truth of the matter is that is evidence-based, it's working, and we have 30 or so programs around the state which are not nearly to scale. And with this kind of push, we could get that to scale. And think how many teenagers we can get into wraparound services before they have that first psychotic break or just after. And so I'm really enthusiastic about this, because for me, this actually fulfills this overall measure, fulfills the original intent that motivated me 20 years ago to want to do this. Homelessness was a problem then. Now it's a worse problem and a worse crisis now. But we must focus these resources, more of them, on helping people and helping our state and our communities change this cycle that is tearing us apart and is accommodating, whether we admit it or not, unnecessary suffering around the board. So thank you for the moment and the time. I'm joined, I know, by my Karen Larson and the Steinberg Institute team, who have also been really, really instrumental in working with the administration, with you, not just this year, but over the past couple of years,
yes,
to lead us to this historic moment.
They've been great partners.
Yep.
Great partners. All right, thank you.